Hi, Garrett. Hi, Kathy.
Hey there.
Hi, Garrett. Hi, Kathy.
Um, I don't know if Noreen is gonna turn up. Sometimes she's a little late. Anybody heard from her?
I have not.
Oh, speak of the devil. And here she is. Oops. Why does that always happen?
Hi, Noreen.
Hello, how are you, Arlene?
Good.
Hi, Kat.
Hi, Noreen. Okay, this is it because Wim isn't joining us. So for the sake of the recording, this is the Board of Health meeting of July 2nd, 2025. Four of us are here, myself, Catherine Hilton, Arlene Reed, Garrett Simonson, and Noreen Pease, and we have a guest, Kathy Timpson. Let's start out with the minutes from last time, whenever that is. I had sent out a draft of them and I had left something out, and Arlene mentioned it. Let's put that off. I'm not positive I actually wrote that into the minutes, so I'll get it into the minutes and I'll send it back out to you and we'll approve them next time.
Okay, but I think you did. I think you sent out, I just read before I logged in to this meeting, I read updated minutes that you sent
Oh.
email,
Oh, okay. Can we go ahead and approve those and get them
the
off our?
updated version. Yes, I move we approve the updated version.
Second.
Okay, any discussion? Okay, Noreen,
Yes.
Garrett,
Yes.
Arlene,
Yes.
Kat, yes. So there's the minutes. Before we get into our updates, let's find out what's up with the Timpsons. Hi, Kathy. What did you come to just
You're muted, Kathy.
Yes, I'm unmuted now. I just was scrolling around and noticed you had a meeting tonight. I have no idea if there's any reason for me to be here, but I just said, oh, let me see if this works, and it worked. So hi.
Hi.
Maybe I don't need to be here right now, but anyway.
Sometimes it doesn't work.
Right, yeah. Right, yeah, it's a good thing to test.
I spend a little bit of time on Zoom, but anyway, I just was like, oh, does this work? And can anybody get in? And I can. So anyway,
Well, you're welcome to hang around and listen to the meeting or log out, whatever you feel like.
Okay. I mean, is there anything I need to? I don't think so. I think I don't think we're ready yet. So.
Okay, I saw a building permit application for a shed for you guys, but it looked like it was withdrawn, and that isn't really anything that I would have to worry about.
Yeah, I mean, Tim, we did the application online and went through the whole thing, which was a little laborious, and it came back with asking some questions, and Tim finally called the building inspector and he said, you don't need a permit for that shed. So I guess he withdrew it. We didn't withdraw it.
Even on I thought it said it was going to be on a concrete pad. You don't need a permit for that?
It's not going to be on a concrete pad. It's going to be on a packed earth stone pad.
Oh, okay.
And so that's because ordinarily we have done shed permits before, but mostly in terms of setback from wells and septic systems, if I'm not mistaken. Kat, it's been a while back.
Right.
Yeah, we're fine with that. We know where it is and we know where our setback is, right?
Okay.
So, I mean, we have it marked off. So, and the pad will be prepared. We don't have a date for that yet, but we've read all the setbacks and everything, and we're good.
Okay. All right. We'll take your word for it.
Okay.
Since nobody's asking our opinion, often we get requests to these, and usually the Board of Health signs off on building permit applications if they might be near the well or the septic system. But if they don't want our signature, then you can do whatever you want.
Okay. Yeah, I mean, when Tim called and talked to the building inspector, he said, oh, no, you don't need a permit for that. So, okay.
Yeah, because you're not, I guess because you're not digging into the earth particularly.
Okay.
No, we're not digging into the earth.
Yeah.
Okay,
Well,
well,
there you
we'll
go.
talk more
Okay,
another time. Thanks so
Alrighty.
much. Good
right.
night, everybody.
Good night.
Good night.
So what I have to tell you is, one, the district is finally going to meet tomorrow. We've been trying and failing to get a meeting together, and we're going to be talking about that. I talked with Megan Tudrin a day or two ago, and I asked her about this thing that Noreen and I were talking about, and that is that we can access services from the collaborative as long as we are actually buying services on our own. I asked Megan about what that meant, and she believes, and she's going to double check this, she believes that it means that if we have committed funds for public health, they could just as easily go to the collaborative as to the district. And I think that it would probably be a good thing if down the line, and by down the line, I mean about a year from now, we, Shutesbury, could withdraw from the district and throw our lot in with the collaborative.
I think that's a good idea.
Are we confident the collaborative will continue longer than
We're thinking that it's going to continue. The mayor, apparently, the mayor of Greenfield apparently reached out to Megan and asked if they wanted it to continue, and pretty much pledged some support from Greenfield. Plus, the money for this, the state money for this, comes as a result of this SAFE 2.0, which is a law. And being a law, they have to fund it. I don't know if they'll fund it as generously as they're funding it now, but if it morphs into something where the individual towns can contribute, we have a pretty substantial budget for the district. We can put that in to the collaborative, and it would require some changing of the general format and the way that the collaborative works. But we could do it.
It would have to be a new arm of the collaborative, I believe. Those funds would have to be separate.
Okay.
It's the collaboratives had a difficult time recruiting, but they've been able to recruit health inspectors. So I think that's part of the thought. And it can, I forget, I'm just going to throw this out, Kat, you can correct me, but maybe our money would fund 25 or 30% of a position. Whereas if we combine our monies with, say, Sunderland and Deerfield, then the collaborative could potentially hire a full-time person who would cover all of those towns.
Right. Right. I'm sure that it would be, I mean, if the other towns do have budgets for this, if they could all be deflected into the collaborative, I think it would be great, and we'd get the most bang for our buck. And I think it would help the personnel problem. There just aren't enough inspectors and whatnot to go around. Mike Thoreau is doing our Title V stuff right now through the collaborative. And I just hope that there isn't some other thing that we need him for a while.
Yeah.
Okay. So speaking of that, there was this email that both Kat and this person who lives on Farrer Road sent an email to me at my Board of Health address, speaking about an urgent need for a septic repair review, or she was trying to submit a permit and application, and she was very confused. And I would imagine why. Our website still says send it to Claudia Sarti, so we need to get that changed.
Good point. I'll take care of that tonight or tomorrow.
Yeah.
And I need to make it clear, not only to the public, but I mean, her engineer is Tom Loya, and he doesn't seem to always get the memo.
Mhm.
It's the engineer who submits the application.
Not the
prepares
homeowner, right,
application and
sure.
submits it. All he gets from the homeowner is basically their signature, and we
Right,
get
and
the
the fee.
spec.
Yeah.
Right, yeah, that
Yeah.
usually comes direct from them to us. So I've told her these things, and I've asked her to confirm that Tom is their engineer, and when she does, then I'll reach out directly to Tom, and I'll
Okay.
tell him how many copies we want and where we want them to go.
Perfect. Okay, thank you.
But yeah, thanks for fielding that. I wonder how she happened to pick you.
I don't know.
I don't know. Oh, and I think we should wait to act on that until our next meeting, because they are direct abutters of mine. And even though I hardly know them, we do have a property line in common, so I wouldn't want to be signing off on that in between meetings.
Sure. Although as you saw in that, for everyone else, in the most recent email, she said, "Oh, could you please consider this to be urgent because the lender, there's a sale pending." And did you see that, Kat?
I did see that. Maybe what we could do is have an extra meeting, a very quick extra meeting to vote on that, so that I don't have to be possibly having a conflict of interest.
Sure, I'd be able to attend an extra meeting, I'm sure.
Great.
But yeah, I guess they've got a buyer, and the bank is just waiting on this permit being signed in order to do the closing.
They
So
just need the permit, they don't need the installation?
don't take my word for it. I would have to go back to her email.
Yeah, well, she might not even,
And she was, I don't think her email was particularly clear about that.
no. Okay, I'll follow up, and then if we can schedule a little extra meeting after we receive the application, then
All right.
I'll.
Kat,
I'll
I will
post you guys
forward,
time.
I will forward to you the email in which she said, "Oh, could you please make this urgent?"
I think I got that.
Okay, if you didn't, let me know and I will.
Yeah, I got that, and she mentioned a buyer and a bank.
Right,
And
yeah, okay.
Okay, so is there more stuff to talk about? Garrett, I understand there's a MAFCO meeting next week. Is that something that some of us should plan to attend, or just you, or what do you think?
You're always welcome to attend, but I'll cover for us.
Mm.
It's not going to be anything earth-shattering.
Okay,
It's kind of the beginning of the budget period. Basically CDC has said to the states, we're going to give you 75% of the funding until the end of September.
yeah,
And then after that, assuming everything is going to advance the way they think it's going to advance, the remaining 25% will come. So we'll see what
I
happens.
see.
Okay.
Yeah, it's lots of anxiety there.
Yeah.
No kidding.
Kat, I had a follow-up question too.
Please.
The article that you wrote on water testing for Lake Wyola, that was in response to some queries that were going on Nextdoor. Haven't seen that posted. I'm assuming you did, or you're
I
planning
did.
to.
I
What's the
did.
status of that, and what's the status of? I think I suggested maybe we should post that also on our website and possibly notify Lake Wyola Association so they're clear as well.
Yeah, that's possibly a good idea. I'm not sure if there's a good space on it for the website, but I'll try to do that. Meanwhile, the discussion seems to have petered out. There hasn't been any posting for all day, and I'm
Yeah,
hoping.
I hadn't
anymore.
seen anything for several days, but that doesn't,
No,
I
I
don't
thought
always look at it.
Mhm.
I've seen it posted.
Yeah.
Yeah.
Yeah, I put it up yesterday, I think, and got a response or two.
Okay,
And I would just provide an update on the Morse Hill
Hmm.
situation where there were two documents that had not been available at the time of their inspection, and they are now on file. And rather than Kat and I agreed that if I just got a photograph from them of it being posted in a conspicuous place, which was part of the fire inspection report. So anyway, I got photographs and forwarded them along to the board. So those are on file.
Have we written them an actual permit? Do you know? I don't remember if I did.
I didn't know there was such a thing.
Yeah,
Okay. I thought it was just a matter of all these other.
yeah, yeah, they get a
building
license to operate from us. I'll
I
check, I'll check the permit file, and if I haven't done that, I'll do it just to,
Not know that. Okay.
dot the i's, cross the t's.
All right.
All right. Is there anything else that we should think about?
just one other question. I think I missed I did miss the mosquito presentation. How was that? Wasn't there a special meeting on the mosquito district?
There
Kat?
was, and it seems like it was so long ago, I can barely remember it.
It's okay. I was just,
It seems to me that it was good. Oh, and Sarah, because I was having problems with the Zoom at the time, because there was something wrong with this computer, and I gotten it fixed. But I turned the host of it over to Sarah, and she sent me some kind of um, a file supposedly containing the video, but I'm not positive that that was the right thing. So I'll follow up on that and see if I can get it so that it can be disseminated to anybody who's interested in it.
Mhm.
that's good, or it might be a source of an article again for us, or, just letting people know it's available, something of that sort, Cats, because I think any exposure we can give to people about what we're doing with the mosquito district is a good thing.
Yeah, you're right. And it wasn't terribly well attended. I think there were only like 2 or 3 people there that weren't us. And so I can, once I get my hands on the video, and I've kind of forgotten about it, I'll send out a town announce saying, I bet you missed this unless you're, A, B, or C, but you can access it.
Okay, I think that'd be great, yeah.
Okay.
The only
And
other
we
thing
can
I
add
would
it-
add, I'm sorry.
I was just gonna say, then we can add it to things that we've done this year, when we have to
Right.
make our report.
Right. If I can just keep it in my mind long enough, which is getting to be kind of problematic.
I ran into someone recently who is on the staff at the elementary school who said, oh, by the way, next fall, we are going to need a new substitute school nurse. And she wondered whether or not I was interested in that. And I told her that I had let my nursing license lapse when
Mhm.
it last expired, so I was not able. But I said that I would pass the word along, and I have conveyed this to Sarah, and I'm going to get Sarah talking directly with them. Sarah will spread the word to her colleagues. But if anyone else, and it's the sort of thing where it might be spur of the moment, very short notice that.
Right.
So it's a kind of a weird ask. But anyway, just so people know, there is a need for a substitute school nurse at
Okay.
the elementary school in the fall.
Okay. Might be good for them to have a couple of substitutes because you can't always
Hey.
Right.
get one, you know? Okay. Anything else that should come before us? Well, let's then declare the meeting over and ask Noreen how Carol is doing.
Oh,
Yeah.
well, she had her cast off on Monday. We went back down to Stanford and she was relieved for about 2 hours. It felt great. And then the doctor warned her and it happened. She got slammed with pain, I guess because it's out of that confined,
Yeah.
compressed space. And so she's been slammed with some pain for that. So anyway, she's feeling better. She's a little more mobile, but she's still going to be non-weight bearing for at least another month, maybe a little longer. We'll know at our next visit, which is the end of the month. So thank you for asking. I'm sure she'd welcome any phone calls or
Yeah,
Oh, yeah, good point. She must be bored.
she
Yeah.
must.
Yeah. Well, no, she says she's not, but I know she welcomes, talking to folks and even
Right.
emailing, whatever's easiest if you think of it.
Okay.
Right.
Anybody, what about Wim? He was still suffering the last time we spoke.
I don't know. He just had a social engagement tonight. He didn't stay away because he's in pain. So
Well, that's good news.
I don't know. Haven't heard. I mean, he might be in pain, but that's not why he's not here.
Okay.
Anything else anybody wants to throw in there?
No.
Okay, well,
Other
let's.
than I can't believe it's July.
Yeah.
I
I
know,
know,
how did
right?
that
How'd that
happen?
happen?
I don't know.
Yeah, that seems to have surprised everybody. I don't know about
Yeah,
for sure. So let's plan to have our regular meeting in 2 weeks and possibly a quick focused meeting for the Farrow Road people.
Yeah.
If that
Anybody have the date of what that would be? Just
well, the next meeting would be the 16th, so that would be the
Okay.
9th.
okay, July 16th. Okay.
Right, and possibly an extra meeting on the 9th, or if the Wednesday doesn't work, we can find a time that works. We'll only be meeting for a few minutes. It won't,
Okay.
it shouldn't be too hard.
okay. Sounds
Okay.
good.
All right, well, if we're all done, we can, I'll let you go back to your lives.
Okay.
Yep. Everyone have a nice holiday.
Happy.
Yes.
Yes,
Yeah.
yeah, good holidays to y'all.
Okay.
Take
Bye.
care.
Good night.
Same. Okay. Bye-bye.
So-